And it's a lot of people, a lot of the next generation of folks that they're passionate about this. This isn't their job. This is not their full-time responsibility, but they're administrators looking at how do they make this a part of what they do because they believe in it. All of us want safer products. I mean, it's not rocket science. We want to be healthy. And if anything, if you're a buyer, you have a great opportunity to not just buy the best price, but to help transform a supply chain. And anybody can do it at any level.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we speak with Kyle Tafuri, Vice President of Sustainability at Hackensack Meridian. You are going to hear so much in this conversation today with Kyle. It's entrepreneurship. It's just being willing to get your hands dirty. It's about creating your own opportunity and making an impact on truly the health and wellness of people. We're going to focus on chemicals specifically in terms of environmental sustainability, but he's got some best practices for you related to how you in supply chain can make an impact. He's really an exceptional individual.
100% he is. And I tell you what, I'm from Nashville, Tennessee, and they call this a 10-year town. You have to come here and put your efforts in for 10 years to be an overnight success. Kyle has done that. He is now on the national stage. He's done a wonderful job educating other healthcare systems and suppliers of what they need to do. And so come along, listen to us today because he is really good at what he does.
Yep. Take the first step, and that is listening to this episode. We'll be right back with Kyle.
Yes! Yes! I'm Hayes Waldrop.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Well, at long last, we have Kyle Tafuri, Vice President of Sustainability at Hackensack Meridian, joining us today to talk about sustainability. Kyle, you and I got connected, I don't know, maybe 18 months ago, got a chance to get introduced, and I know you've been hard at work ever since then, so we finally got a chance to get this scheduled, and you have even more updates on sustainability than we had 18 months ago. There's a lot been going on, so I want to welcome you to Power Supply. Thanks for coming on.
Thank you, Justin. And yes, it's been a long time in the making. And I believe, I don't know if this is bad luck, but every time you would reach out and we try to schedule this, things would just go crazy schedule-wise. I'd get all these added tasks on board. So I'm not sure if I want to thank you or not, but glad to finally got this lined up.
Justin has that impact on most people. Just, chaos follows, that type of thing. So get used to it.
Create more work, more tasks, more headaches.
Yeah, wait till this thing drops, then you'll really understand what it means.
Yeah.
So, yeah.
That's like a whole human tornado is what you're making it sound like.
Yeah.
So the Tasmanian podcaster. All right. So Kyle, why don't you tell us a little bit about your background in general? Like, how did you even get involved in sustainability. Brian Bartell, who's on our Power Supply Advisory group and also puts together our newsletter, introduced us. That's how we got connected. He had seen you present at a Health Trust conference on sustainability. But, I'm curious, a lot of times we talk to supply chain professionals and everybody just kind of falls into it. And sustainability is another one of those areas. I wonder if you just kind of fell into it in a way.
Yeah. I think sustainability was not something I ever set out to do. My undergrad was, I had two majors. I come from a family of lawyers and judges. So, growing up, you pretty much just figured out and become a lawyer or a judge. I studied business law and entrepreneurship in school. In my undergrad at Boston University, had no idea what sustainability was. Didn't even know when I graduated. I, like most kids, in college, I thought I had it all figured out. And then when you graduate, you realize you figured nothing out. And, I took a job in sales actually for one of my old hockey coaches that I played for growing up, selling various commodities. And I sucked at it. It was terrible. Therefore, I hated it. Then I said, well, you know what? I don't want to go to law school. I took an LSAT course actually for about 5 minutes in college when I was graduating. And I opened up a practice test for the LSATs. I opened it, read the first question, I closed it and handed it and said, no, I'm good. Thank you. So I was doing the sales job, sucked at it, hated it, and then said, I want to do something else. I want to make an impact. So I ended up saying, I want to become a federal agent. So it took a complete turn. My family, other side of my family had been involved in NCIS, naval intelligence. So I said, let me go do that. At the time, though, if you couldn't speak Arabic, you weren't getting selected. So they told me to go into the state police for a year and, then transfer. And then it'll be easy for me to transfer in. So planned on doing that route, but then I had to get hip surgery. My hip was bothering me a little bit. So got hip surgery and had some time to think and realize I had no idea what I was doing, but I didn't want to keep doing the route I was on. So I picked up the book by Yvon Chouinard, the founder of Patagonia, Let My People Go Surfing, and learned about environmental sustainability from a business perspective. And it was one of my aha moments. And I said, I want to do this. I want to work for an organization and just be a part of this movement. So the next day after I read that book, I picked up a newspaper, which I'd never really done before either, and saw that there was a master's program by me at Ramapo College. And there were two programs at the time. Ramapo College had one and Columbia, but for grad school, I had to pay for that. So it made Ramapo a very easy decision.
It's much more attractive.
Very easy choice. Yep. Just parking my car at Columbia in the city was enough to say, yeah, you know what? I'm good. I'm good on this one. And as part of that, it was one of the best things that I've done in my life was to do that program. As part of the thesis for that, I did it at Hackensack University Medical Center, which goes to show you at the time kind of the evolution of healthcare. Hackensack was one hospital at the time. And if you fast forward to today, we're 18 hospitals, school of medicine, over 500, 600 offsites. But anyway, I did my thesis on healthcare sustainability, presented it to the executive team at Hackensack UMC, and they offered me a job after I presented. And one of the executives came up to me and he said, do you want to do this full time here? And I said, like any kid at the time, I'm like, sure, why not? Sounds cool. And we got to create the job description that I did. And, ever since kind of just gotten to create the role and have it evolve as time has gone on. And I started off as a sustainability coordinator.
And they didn't have an infrastructure for this, right? Like that coordinator position was the only position in sustainability.
They did not have a sustainability coordinator. There was an environmental health center that was very dedicated to some environmental health research and some different things of that nature. It was the Deirdre Imus Environmental Health Center. So related to Don and Deirdre Imus, it's really, if you all remember Don Imus, the famous radio host. They had an environmental health center that did a lot of good work. But, the work I was focused on was strictly looking at the operations of the hospitals and really ingraining myself into every aspect of the operations. So it was really, they were ahead of the curve with their thought processes, but healthcare was so behind other industries in this work, just so behind. And it's ironic because when you think about health, I mean, how do you have health without clean air, clean water, and healthy soil? I mean, those are basics. But, healthcare likes to play catch up in certain areas, and there's no exception.
How did your undergrad in entrepreneurship prepare you for the position?
So that's a very good point because, when I was doing the entrepreneur track, I liked the freedom and the creativity and, being able to create your own opportunities. And there's parallels with life, with that. It's all about creating your own opportunities, not being pigeonholed into something, but, being opportunistic. And that was the one thing that I think that drive that you have, when you play sports, when you're training for something, you're always pushing and trying to push your body past its limits per se. And sustainability, really my whole career with Hackensack has been about being opportunistic. I was never the smartest in the room. By no means in undergrad was I winning any awards for academic excellence. But, I listened, I observed, and when an opportunity came up, I jumped and I pounced on it and made the best of it. And if nothing was there, you just find one, create an opportunity. And that's how I think we've been so successful in this journey was that mentality.
Well, Kyle, let me tell you, you are the smartest guy in this room right now. I can assure you. So that'll make you feel somewhat better. But take me back to that presentation to the hospital at that time. Literally, you give the presentation and someone gets up and goes, "That's phenomenal. I want to hire you." Is it like that?
So, I think it was something that healthcare is so competitive that, obviously we all compete, in the sustainability, and we could talk about this another time, but, part of what I love about sustainability is that collaborative nature. I'm talking to all of my counterparts at other institutions that would normally be considered competitors. And a lot of healthcare people would not want to share everything, but in our line of work, we are sharing everything because it's something that if one of us is doing it and others aren't, it doesn't mean much. It's not going to have that impact. So I gave the presentation. The project I was doing was more of doing a benchmark assessment of where Hackensack stood in relationship to best practices. It helped, speaking of opportunistic, they had an MOU, a voluntary MOU with the EPA around certain metrics. And like everything, I think the agreement kind of got swept up and some folks forgot about it. So when I just so happened to come in, that was due to be reported out on in a few months.
And you had the data, and they didn't have the data.
Timing was right. I had the full assessment of where they were at to what they agreed to, and it was all voluntary. So it was kudos to them for making that commitment, but also kudos to them for not staying as on top of that commitment because it gave me the opportunity to get a job.
That's fantastic. I mean, I love it. Honestly, you fell into something that you love to do, and by doing it, you got a great job. And now you're an integral part of what they do. That's fantastic.
Yep. Yeah. It's a great
Sustainability means a lot of things too. So you've obviously evolved in all of the different areas of focus over the time that you've been doing this. And, our audience is obviously supply chain. You don't work in a supply chain function, but as you mentioned, it's very collaborative. And so you touch lots of different departments and obviously procurement and the types of products and chemicals and anything really that a hospital is going to use in the delivery of care is running through supply chain. So I would imagine that your partnerships and maybe even a lot of your educational efforts hit home there because you have a great deal of ability to sort of impact that environmental sustainability. And I'll even say sustainability, you almost have to put the environmental in front of it now because it's taken on such a broad context in healthcare. But I want to get even more refined with it because you took an interest in chemicals specifically and their impact on the environment. And you also identified, what like regulations were in place. And so can we narrow this conversation down a little bit and talk about your specific interest related to chemicals and maybe the current state of affairs in this country when you're talking about environmental sustainability in chemicals?
Yeah. And I think, it was interesting to me, from a supply chain perspective, and maybe this is just how I view life, but, you could look at it that you're buying, widget A or widget B to deliver patient care, which that's what we're here to take care of sick people. And I think that's where we're seeing an evolution that has to occur because, with what do they say, GDP, healthcare GDP in the country is going to be over 20%. And you look at it and it's like, well, what do you want to be spending your money on? Being sick or being well and other things that are more life-fulfilling things than chronic disease. But I looked at chemicals and I'll never forget, I saw the Chicago Tribune had an article about flame retardants and the link between these chemicals and cancer and all these different chronic diseases. And here I am, an outsider to healthcare. I didn't really have much experience other than, inviting myself to every committee the hospital had and Googling, every single topic they were talking about because I didn't have a background in it. But I did have common sense. And I saw that, chronic disease in this country is absurd with the amount of it. And when you talk about prevention and where healthcare has to go, why do we have such rates of chronic disease, of high rates of chronic disease with the amount of money that we spend for healthcare? It just doesn't add up. We talk about value. That's not value. So when I started to look at, I read the Chicago Tribune series and I watched Toxic Hot Seat, a documentary on HBO that kind of built off of that and just saw how only a handful of chemicals were regulated in this country, and the onus was put onto the government to determine whether, the chemical was safe or not. But they didn't have all of the information necessary to make that. It was the companies pretty much saying, oh yeah, this is safe or this is unsafe. And the more I looked at it, I saw that I said, hey, if somebody's going to drive change, we're not just buying a product, but we're buying, we have the capability to transform supply chains off of our buying power. We spend billions of dollars in the supply chain a year. So hell, if the regulations aren't there, let's drive it to a safer marketplace ourselves. That's what everyone says, let the market dictate, what happens. So let's put our money, into that bigger picture of health and let's just drive it. But in my experience going down to Capitol Hill early on in my career, having no idea how the government truly worked, other than what you learned in school and some stuff you watched. But when I went down to Capitol Hill, it confirmed my thoughts that no, we got to move the supply chain ourselves and let's do it through our buying power.
Why did you go to Capitol Hill? And, what was it that you were doing when you went?
I went down because I was pissed off. There's no way to change it. I just, when we were reaching out to suppliers to just get basic information around safer chemicals, I wasn't getting what we were looking for. We got a lot of, we got to talk to legal. We got to talk to this group. We got to go to, and I'm like, this is a load of crap. Like, no, I mean, we're advanced. We're so beyond this. Like, I thought, we preach innovation. Why is it like, it's an act of God to try to just find out if certain chemicals are in somebody's product. So I said, you know what? We do need policy help. We do need help pushing it, because these folks clearly aren't driving it. They're not, voluntarily pushing strides. And, they took it as like an either or. Either we create innovative life-saving products, or we create, products that have safer chemicals. I'm like, no, BS. You're innovating. Figure out how to do both. That's what we do. Like, enough excuses. So I went down. The TSCA reform was happening, the Safer Chemicals Act. It was very outdated, and it was being talked about as trying to come out with a newer version. And not much really changed in the end. But I said, you know what? And this is where Hackensack Meridian Health, they let me go down and advocate, and to use kind of our brand from a healthcare perspective to talk about chemicals as a way of saying, hey, we got to prevent chronic disease. And we view this as one of the ways in doing it, and pushing for greener chemistry and safer chemicals in our products. So,
but Kyle, this goes, just the chemicals that are in our food supply. I mean, we're talking about everything right here, right? I mean, it literally goes from the, spraying corn in Iowa, going down the Mississippi River to the manufacturing plants everywhere. Is that kind of where you're going with a lot of this?
It was everywhere. And I think, when you frame it like that, it can get overwhelming. So we just said, you know what? Let's try to build this into the foundation of what we do, knowing that from a healthcare perspective, we spend billions of dollars in the supply chain. We're not going to catch everything, but where there's momentum, let's be opportunistic and capitalize and drive change, and start off with areas like furniture. We spent a lot of money on it. So let's start with that. And, we got the chemicals of concern out of the furnishings. We bought furnishings that met that. And if they didn't meet it, we partnered up with other health systems to get suppliers into the room to say, hey, we got $55 million of furniture spend here. If you don't get these chemicals out of your product, we're just going to take the $55 million and give it to somebody who is. But it's everywhere. And, I think there's good and bad with social media, obviously. The bad, obviously, you just got to log in to see the bad. But the good is that it helps disseminate information quick. And it helps, in certain regards, to some level, to accountability. I think a lot of things, you're seeing stuff with certain chemicals kick off, and, it can catch a trend on TikTok or whatever avenue folks use, and it gets information out quickly. So you're able to learn pretty quick and hear about certain topics. So chemicals, we were doing it before it was sexy, you could say, but we were doing it because it was the right thing to do. And we didn't think it should be an either or type of conversation.
What are some areas people might not realize chemicals are so heavily involved in, or maybe there's some easy wins? Like, you're obviously sophisticated as an organization, right? You've been building this for quite a while now. And I definitely want to hear, before we wrap in a few minutes or so, about the process you went through with Joint Commission. So that's kind of an update since you and I last talked. And I know it was an arduous effort. So that's the teaser for what we're going to wrap up on in this conversation. But for people that are listening, that are especially in that like strategic sourcing or value analysis position where they're evaluating, new products or going through RFPs, I feel like there are maybe some key areas for them to have, in their consideration. And even in this category of indirect spend, right? Like there's a whole area, about 80% of healthcare spend that's kind of outside of that group purchasing national agreement level that's really localized. And so I feel like that's an area where it kind of slips under the radar too, because maybe you're not getting kind of that strategic partner as a supply chain to evaluate some of that. And so what are some obvious categories that people should be keeping in mind when it comes to chemicals specifically?
I think First there's organizations out there, and this was something, we're a member of Practice Green Health and the parent group Healthcare Without Harm. I think the first thing is to kind of connect with groups like that or with other leaders in the field to just get some guidance, because starting off, first off, anybody can impact change. One buyer can make an impact by looking at this stuff. But how we started was we went to some of the groups that were kind of the thought leaders in this area, and we copied kind of what they had in certain regards to things like looking at IV bags. So IV bags, we looked at PVC and phthalates. That was an easier target. And we were able to convert, that's a large scale, obviously complicated piece. It's not something that's, a one-off, but IV bag solutions were a huge thing. But there's a company out there that had PVC, DEHP-free IV bags, and the timing, everything kind of came together, and we were able to convert from a supplier that had that to one that did not. And, obviously there was a couple, supply was a factor, cost was a factor, but sustainability was also a consideration. So that was something where it all came together. But, starting out just in the building environment, we spend most of our time in buildings. So look at the building supplies like flooring, furniture. There's so many aspects of the built environment where you're not hitting, clinical conversions are obviously a little bit tougher. That being said, we've been able to kind of embed that into our policies and processes, but you start, I always suggest starting in an area like that. That's a little bit easier to look through and a little bit further along, the built environment. They're very consumer facing as well. So it's something to do, but looking at that, or even food, food's one, like local and organic, sustainable food. Food is medicine. And now we're seeing a lot more, which is amazing. We still have to say that. But yeah, those are areas.
Well, first of all, Kyle, I love the way you're kind of like, how do you eat an elephant type thing, right? You're saying, let's go to a granular level. Let's go after 1, 2, 3 things rather than, to your point earlier. If you try to tackle the whole thing, you'll never get there. So I like that a lot. And, as it relates to, is there a blueprint out there? The guy from, some guy in Tulsa, Oklahoma that, is in supply chain and trying to do the right thing, trying to purchase the right things. How does he find these different companies? Is there a list? If y'all developed a profile of these different companies, and or the last question, part of that is it always more expensive to buy from these companies?
Oh yeah. Well, that's what, I think when you look at our organization, supply chains, we've been leading in that. And our supply, if you met, our supply chain leaders, there's a reason why we've been so successful. We've gone about it the right way. And, anything can cost more. And that was one thing I learned, that sometimes, a supplier or somebody would come in the room and because their product was green, whether they marked it up a little bit, but they would say, well, yeah, there's a price increase because it's green. And I'm like, well, take the green aspect aside. That's not true. You're just looking. So some folks looked at it that way, but everything we did, when you look at sustainability, it's about reducing waste. So cutting down waste. And that's how we frame our entire program: reducing waste, reducing energy, reducing water consumption, reducing, becoming more efficient in the supply. It was all around efficiency. So we were reducing, and, we've saved a lot of money in a number of areas that we've gone about. For the furniture and going to the flame retardant free, immediately it was a 30% savings just by that, because the flame retardants were an added component to the furniture that people had to pay for. Now you're taking away that flame retardant, which was toxic, and moving it away. So, it's like anything. You got to just ask some of the questions. And that's where there's organizations out there with guidance, or folks can reach out to us or many of the others. But there's a lot of information out there now. There wasn't as much when we started, but now it's kind of becoming mainstream. And some of the GPOs they have some robust programs around this with information. You just got to ask the question.
Do you think, just based on your experience, there may be supply chain folks that are listening to this that want to do more, but bandwidth is a major issue for supply chain out there right now due to, workforce shortages, experience shortages and retirement, lots of different things going on that are at play. You've obviously made this a full-time gig. Do health systems need to have somebody in that position to really be coming alongside supply chain and advising them and doing that kind of work to be successful? Or can you get some small wins as you're sort of encouraging, maybe? Because I guarantee you there are people that are listening to this that do not have somebody focused on sustainability in their healthcare organization. So, if they don't have somebody, how do they incorporate that? Or do you really need to go and advocate to leadership and say, we've got to have somebody in this role?
I think it starts with finding somebody within the department, somebody in the area is going to be passionate about it, and just identifying a champion to just be there and ask questions. So a big agreement's coming up or some big RFP is coming up. And if you don't have a dedicated person, there's ways to embed it into what you do. So if you're a leader, it's putting it into the RFP or the RFI. Just, when you initially go out there to gather information, ask the questions to the supplier, and you're going to get a lot, and you're going to find that out. And listen, we have over 37,000 team members, and, the team is myself and now one other colleague. So when you embed it into what you do, and that's why it's important for a supply chain leader that's listening to this, start to ask the questions about it, and you'll be amazed at the information you find. So if supply chain leader, that's the first thing. You include it in that, or you go to your GPO and ask them, what are you doing for this? And go to your key suppliers saying, what's your organization's stance? Do you have a PVC elimination plan, or what's your commitment to reducing your emissions? Most of the mainstream suppliers have that. They're all moving in that direction. If you're a frontline buyer, that's in the trenches every day with an endless list of things, just look at the different areas you have, and same thing. I mean, a buyer can pick up the phone and ask a supplier the question, do you have this or do you have that? And find organizations like Practice Green Health. I mean, they have over 1,000 hospitals that are members of this. And if you're a member of that, you can get information and you can get hooked into different groups, because everybody in this line of work is willing to help other folks.
Yeah, I feel like buyers is a great place. Like, as a strategic leader, you weave it in, in lots of different ways into the RFPs. But I also feel like the buyers can be major information gatherers. And so to your point, if they get involved in any kind of sustainability efforts or, participate in Practice Green Health, they can collect that information and maybe raise up where there's opportunities. And maybe there's just a way to report opportunities, or even maybe a success story with a supplier, like ran across this supplier and they're already doing this, and this, but maybe there's a way to create an inbox or, some sort of repository for feedback like that, so that, organizationally you can start to get a little bit of a clearer picture from the people that are doing the day-to-day, right? And maybe there's an incentive program for that, right?
Yeah. And it's also just finding like-minded colleagues or people that are, passionate about this within the organization to help. It's not a one-person journey, whether it's physicians or clinicians. I mean, we've been getting a lot. I mean, it's really gone up a lot before, but, if these folks are going to conferences, looking out for sessions on that. And we mentioned this earlier when we were talking. I just gave a talk out at ACHG. When we first started talking about sustainability, we compared it to a musician. You have a couple people in the room, you're basically talking to yourself up there. Now, when we talk at conventional, the entire room is packed, and it's a lot of people, a lot of the next generation of folks that they're passionate about this. This isn't their job. This is not their full-time responsibility, but they're administrators looking at how do they make this a part of what they do because they believe in it. All of us want safer products. I mean, it's not rocket science. We want to be healthy. And if anything, if you're a buyer, you have a great opportunity to not just buy the best price, but to help transform a supply chain. And anybody can do it at any level.
All right, we got like 3 minutes left. That was a great closing, but I just want to hear what you did with the Joint Commission. So just talk about, were you the first to go through this process? Okay, so you're still innovating, you're still an entrepreneur, and you're finding even more creative ways to do it. Take us home on this Joint Commission project that you've been working on for a while.
So 4 of our hospitals were the first in the country to receive the Joint Commission Sustainability Certification. It was a very interesting process. I would not recommend having 4 hospitals go at the same time when you want to talk about bandwidth. But, hospitals are competitive, and we had 4 hospital presidents. Our leadership drove this. I did not come and say, we're going to do Joint Commission certification. I mean, great if we did, but our presidents wanted to do it because they wanted validation of the efforts that they were making, and they wanted to be first in the country. That was good. So it was driven by our regulatory team. From when we said we were going to do this, we met weekly. We had what the standards were. We'd been doing this work. There was no BSing it. The reviewer had a checklist, and we went down, and it was predominantly around our scope 1 and scope 2 emissions. You picked 3 data categories. So we chose 2 energy ones, and anesthetic gas, which eliminating desflurane is a great money saver for anybody out there in the supply chain, although it's typically purchased through the pharmacy component. But we had those 3 areas, and we met weekly. Our regulatory team kind of created the framework as we had for any Joint Commission certification, and we went through it. We had a lot of documentation together. If you asked me how it was during the process, it was tough, but in the end, we get to celebrate and say how great we are. It was real. They had real standards, and we surpassed them. So
did you help them develop these standards as part of this process in a way, or not?
I am sure that the reviewers that were with our 4 hospitals, who are 4 of the reviewers that will be moving forward, I'm sure they learned a good deal. We set the bar high. I will say that we were prepared. We're living it. And this wasn't a 1-person show. This was teams throughout the organization. And I will tell you right now, there's not as much of a supplier focus, but as with anything Joint Commission wise, you're exposed, to your own internal leaders. They're looking at gaps and deficiencies in the work that you're doing. And I was saying this, from a supplier standpoint, I would really want to be not a supplier that gets called into the room saying, hey, we're not able to achieve A, B, and C because of you. Not a good look, because we had our hospital presidents in the room. Like, there were leaders in the room, and it's all about processes and all that stuff. And we had very strong on our side with our purchasing. We included our sustainable purchasing policy as part of our packet that we provided them. So
yeah, just increasing awareness is such a huge key to, helping move initiatives like this forward. And so to your point, opening the book, so to speak, and taking a look at what's in place, and having so many different people be involved all the way to the top of the organization is how you influence change. And Kyle, you've literally gone from the bottom of the organization, not even as an employee, but an intern, putting it all together, to running one of the most, progressive sustainability programs in the U.S. for sustainability. So I just want to congratulate you on your career arc, your ingenuity, and, taking all these different backgrounds and experiences that you've had and kind of putting them together into something that is, truly inspiring. So Kyle, great job today. Thanks for coming on the show.
Thank you for having me. I'm hopeful that, listen, if we're the only ones doing it, it doesn't mean much. It's one of those things that everybody can play a part, and we're more than happy to, help folks and just drive change.
All right, Kyle Tafuri, everybody, Vice President of Sustainability at Hackensack Meridian. Really an inspiring story, Hayes. And I mean, I think he said it best. I'm not even going to try to summarize other than to say, just take a step forward. You don't have to have a big, robust sustainability team to make an impact.
100%. That's exactly what he just kind of, he went back to multiple times. Get started. Ask a question of your companies, your suppliers. Ask a question and get started. And I think that was the take home for all this. Wonderful job. He is literally leading the industry. I learned a ton. And I think if you're interested, I'm sure he'd love for you to reach out to him. But great job, Kyle.
All right, everybody, on behalf of Hayes and myself, thanks for listening to this episode of Power Supply.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.